I told her she has a lot of movement from the teeth, so there may not be enough room. We'd have to look and see.
Okay, good. So Maya, first off, so Mariah, she kind of, the hygiene department in our practice, they focus on prevention, right? They're gonna try to keep your gums and your bone healthy so that your teeth will stay there a long time.
Okay.
So before I go build a pretty smile, I wanna make sure that we have a good healthy foundation. So Mariah makes sure that we keep that healthy foundation.
Okay.
And right now you've got an active infection in the gums and the bone. So Mariah will need to make sure we treat that. Once that's treated, that'll also tell us a little bit more about how you respond to that treatment and how your body responds. Will tell me more too on how to fix your teeth.
Okay.
Because we've got to make sure that that foundation's healthy.
Right.
Does that make sense?
It does.
Okay. Well, let's go take a look at your teeth. So here are the teeth front on. So obviously you don't like this.
I don't.
Right? Some of these teeth are a little bit crooked. This one's a little bit more white than this, right? You can see some of the stain here.
That's a cap. I have a cap.
Right, that's a
Yeah.
cap that goes on that, correct.
Yeah.
And it's kind of an older style cap. Notice
Yeah.
how it's all kind of one color. The caps that we do now are a little bit nicer.
Okay.
But the deal is when you have one, do you see how it stands
Yeah.
out? You can
Yeah.
tell, so the eye is very good at telling differences in material and the way it reflects light. There's a lot that goes into how we perceive something, right? And if I look at you and I can see one perfect one that's more white and then the others look
Right.
different, I can tell it's fake. If they're all the same,
Right.
then I look at it and I think that's natural.
Right.
Does that make sense?
It does.
It tricks the eye to make you think it's natural.
Right.
Right? Did you grab my laptop?
Yeah.
I can
And we
tell
talked
that
about
actually.
4 to 12 crowning as well.
Yeah. So obviously that'll need to be fixed. We would want to replace this, and we'll probably want to do some veneers or crowns in the front to make everything look really pretty for you.
Okay.
That's how you get a really pretty smile.
Right.
Okay. So with the stain and the different things that you have here, that's going to be something along those lines will be your best option. I can show you here. Let me show you real quick. What? Another case, kind of like yours, like what we did.
Okay.
So that way you have an idea of what things can look like in the end. So here's a patient that we did crowns and veneers across all the front.
Oh, that's nice.
Okay. So those, those teeth didn't used to look like that. I don't have a before because this was a long time ago, but you think those are natural,
Right.
right? You can't tell that they're not natural because what it does is it tricks your eye. When you go all the way across, then you can't tell because it all blends and looks right, and so the eye thinks, oh, that person just has naturally pretty teeth, even though they're fake, they're veneers. But you see how much more natural these look?
They do look.
And that how this looks a little bit more pasty, a little bit more
Yeah.
kind of stark white, right? So that's how you create that really pretty smile.
Okay.
Okay, is that kind of what you're looking for? That would look beautiful. That would be
Yeah.
awesome. We could do that. And when you have a nice pretty smile, I notice you kind of hide.
I do,
You
because I
don't
don't like.
want to smile. I know you kind of hold back a little bit, don't
I do.
you? That's unfortunate. Well, I want to help you change that.
Okay.
Right? Because it affects your relationships, it affects jobs that you get, right? There's a lot of studies now that show that if you have a pretty smile and you appear well to people, you get better jobs and more fulfilling relationships
Yeah.
and all sorts of stuff. So
I agree.
this kind of stuff is kind of life-changing, right?
Yeah.
So that's exciting. I love that kind of dentistry. So
I know.
we can help you with that.
Okay.
All right, let's keep looking. So here's some of the upper teeth here. This one's actually spun a little bit. Okay, that's that canine with the cavity in it, right?
Okay.
So that one we can unspin. You got a little space here. You're missing a tooth over here. This was one of your big chewers. Okay, this is the upper right side. This is up here.
Over here?
Yeah.
Okay.
So there's that space up there. Okay. So that's where a tooth was missing. So we can put an implant back in there and give you another tooth. The reason that's important is those are your big chewers in the back. And if you don't have those big supporting teeth in the mouth, long term you break down all the rest of the teeth. So those are really critical to long-term function. And if we put nice pretty teeth up here in front, we don't want them to break. We want them to be healthy. and strong. Does that make sense?
It does.
So these back teeth that support all the chewing, those are really important to make these teeth all stay healthy.
Okay.
Okay? So everything kind of works together as a whole. And here's the lower teeth. Huh?
We have one more as well, since it was a little foggy.
Here's the lower teeth. There is a little bit of fog on this mirror here, but do you see all the debris in here?
Mhm.
Okay, so that's all the tartar and the infection that Mariah was talking to you about.
Okay.
So that's the area that needs to be cleaned up, that we need to make healthy. This molar is also kind of tipped forward. See how this molar's tipped way over?
Mhm.
You can kind of see the angle of it.
Mhm.
So really what's best here is we do braces and we straighten it back up
Mhm.
and pull it into to where it's supposed to be,
Mhm.
right? Because right now, that's not functioning like it should. It's kind of like a car tire that your alignment's off
Mhm.
and it starts to wear and it doesn't, the tire won't last as long.
Mhm.
Same with the tooth, once it's tipped over, the forces that are generated
Mhm.
aren't good and you'll lose that tooth over time.
Okay.
So what we'll do is we would do some braces down here and I would actually take this tooth and I would straighten it out and I'd put it right up next to this one like it should be.
Mhm.
So we can actually fix this and make it useful for you long term.
Okay.
Okay, so that's important here too. All right, and this one as well, actually the same thing over here. Just didn't quite see that because of the fog. Can you see that?
Mhm.
How it's kind of tipped down?
Mhm.
So we'll have to level those out for you. All right. Any questions for me on this stuff so far?
I just don't know how the braces like will work. It's just, you could just do one set of braces down here? all across the teeth,
We'll
or-
probably do top and bottom.
Oh, okay.
Because I want to move the teeth into kind of ideal position before I put the crowns on them.
Mhm.
I can make stuff look a little bit nicer if I have the teeth where I want them before we put the crowns on them.
Oh,
Does that make sense?
so you want to do braces first?
Braces first.
And then the crown?
Because I gotta fix all these, right? I can't fix that without braces. Those molars back there have to have the braces
Okay.
to get everything lined up like they need to be.
Mhm.
Because all your teeth were meant to kind of function and fit together like puzzle pieces.
Mhm.
And when they're engineered to bear the load when they fit together like they should.
Mhm.
But when they're out of whack and they don't fit together right, or they're leaned over like your molars are,
Mhm.
then the wear over time breaks them down.
Mhm.
And they have problems with the bone and the gums, and they eventually come out because of that. So your goal is, I'm sure, to have a pretty smile, but I'm sure you want it to last. How young are you?
I'm 42.
So in your 80s, you probably want to have that smile still in your 80s,
Yeah.
right? So an important part of that is making sure that these molars and all those teeth, that they line up right,
Okay.
so that we have long-term health of your entire mouth, right?
Okay.
We don't want to go spend a bunch of money on it and then have it break down prematurely
Right.
because we didn't set it up right.
Okay.
So the braces will allow us to line all the teeth just right,
Okay.
like they should be.
Okay.
And then the crowns and veneers, those will make them pretty,
Okay.
okay? Those veneers just make them white and pretty.
Okay.
But we need functional, we need long-term function.
Okay.
So Mariah's gonna clear your infection, we're gonna do braces to get them all lined up right,
Mhm.
then we'll make them pretty with the veneers.
Okay.
Does that make sense?
It does. So let me ask you this then. Is it a way, because I was just thinking, like, is there like another option to just pull them out and then put implants in them?
Yes, that's an option, but it's a poor option.
It is, okay.
Yes, for someone in your situation, you don't need to do that.
Okay.
That would be a very invasive treatment. It's kind of, it's like if I can do arthroscopic knee surgery, if you have a bad knee, and I can go in there with 3 little holes and I can clean it out and fix it,
Mhm.
or should I just replace your whole knee?
Okay.
Right?
Yeah, right.
That's what it's like.
Okay.
So we don't need to do that.
Okay.
If you were, you would have, your disease would have to be much worse. You'd have to be missing more teeth.
Okay.
And implants aren't perfect either.
Right.
We only do that when these teeth are no longer salvageable
Okay.
or restorable, which they are for sure.
Okay.
So we can fix them and we can give you a pretty smile that can last the rest of your life. We just need to make sure that we're seeing you regularly. So how often have you seen the dentist in the first 30 years of your life? When did you go? Tell me about that a little bit.
Well, I didn't go as an adult until this front tooth was starting to give me issues. And I was like in my late 20s.
Right.
early 30s.
And then I would guess that you probably just came to see us because you saw a problem. And that's kind of what motivated you, right?
Yeah, and then
Right.
I already knew that I need to take better care of my
Right.
teeth.
So we just have to play the game a little bit differently.
Okay.
The rest of your life, you're gonna have to come see us regularly, and we can help you. But the reason you're where you're at is because you just didn't quite do things the way you should have, right? That's okay. We'll be your cheerleaders. We're gonna help you now, and we're gonna get you on a different path, and we'll make things better.
Okay.
Okay? So
Sounds good.
we just have to play the game differently,
Okay.
right?
Yeah.
And we'll keep them. If I didn't feel that I could get you 20 or 30 years out of your teeth, I wouldn't recommend you do all this.
Okay.
I would tell you to take them out.
Okay.
But taking them out at your age is not good treatment. Not,
Okay.
no way. No good dentist would ever recommend that for you.
Okay.
Okay? If you had only 2 or 3 left, then yes, but you've got a good set of teeth that we can still save.
Okay.
Okay?
Sounds good.
All right, good.
Okay.
Well, I'm going to go look inside now a little
Okay.
bit, and I'm going to kind of speak a little Greek to Mariah as we
Okay.
kind of try and put all this that I've explained to you in our dental terminology,
Okay.
right?
Okay.
So I try not to lose you, but I want you to understand kind of our overall goal and picture of what we're trying to accomplish.
Okay.
Sound good?
Sounds good.
Okay, well, good. All right. So is the family here too, or what's?
Yeah, so me and my husband live here.
Uh-huh.
He's from Michigan. My
Uh-huh.
family's in California.
Oh yeah?
So we're all over.
All over, huh?
Yeah.
Okay. Wow, that molar's really laid down, isn't it?
Yes.
Jeez. Both of those.
And it's already a little bit loose.
Uh-huh. So this here, we're gonna need to take that one out.
17?
Yes, let's take out 17. So there may be a few that are better to take out.
Okay.
And I'll tell you that here. Yeah. Yep. Let's take out 17.
Another one that's loose.
Let's go see here.
And then up here as well for some job.
14.
Put your purse on the counter. Have a seat and I'll be right in.
So what do you do for work or kids or
Yeah, I work at PayPal.
what do you do?
Yeah. I work in underwriting and my kids are grown.
They are.
Yeah, my oldest is 23.
Well, that's kind of what happens. You take care of your kids and do all your stuff,
Yeah.
and then later on in life, you're like, okay, now it's time
Take
to
care
take care of
of
me.
myself.
Yeah, we see it a lot. What's that light, Mariah?
Yep.
Take it up here.
Lower, upper.
I think let's see what kind of result we get out of. Let's take out 17 because it's too late now.
Okay.
Let's just see what we get. So you've got an active infection on these teeth, right? I want Mariah to clean them up, and I just want to see what kind of result we get and how you respond to treatment. Okay. If I can get these to tighten up, then I'll keep them. If not, then we'd have to take them out. Just this molar over here, okay? And the one on this end I'm going to take out. The one over here, we'll kind of wait and see. All right. The more natural teeth we can keep, the better off you'll be. Let's take out 14. Did you hear me? 14. Let's get that out too.
Okay.
We need an occlusal on 29. And a lingual on 10. Well, it's gonna have a just
Yeah, I was
add a
gonna say,
build-up,
I
just
did
add a-
crowns.
Just add a build-up to it. Did you have build-ups on them or not?
On all of them, yeah.
You did, okay.
At this point, yeah.
Yeah, and then 11, if you have an, yeah, go back to the X-ray on that too. Again, sorry to speak a little Greek here.
Root canal as well. She said that one is,
Yeah, and then no, and then one as well. Yeah, correct.
the referral.
That's still considered an anterior, not a bicuspid, right? 11?
It's an anterior, yeah.
Okay. Just wanted to be sure.
And let's get 16 out of there.
Okay.
Two is good, that's solid. And then I want you to crown 2 and 15 as well.
Okay.
So those, we added those in, right?
Mm-hmm.
Okay, and then 16 you gotta take out too. The circular up there.
Okay.
And
16.
then you got con ortho in there as well, right?
Mm-hmm.
Okay. So that tells us kind of what we need. We've gathered some information there.
Okay.
There is a few teeth that I'm gonna take out.
Okay.
There's one up here that's bad that I just need to take out. This one's gonna come out. Those two, okay? And then we're gonna kind of, actually there's two up here. The one in the very back's a wisdom tooth. So you'll still keep one more up there, which is really good. We wanna hang on to as many of those as we can. This guy's gonna come out. We'll do braces, we'll straighten everything out, and then she'll have to clean up your infection first.
Okay.
Then we'll do the braces. Then once that's all done, then we can talk about implants to fill in the missing gaps. Does that make sense? So 14, get an implant on 14. Implant the graft. Open up the lid.
I'm just going to let the doctor see it.
7950 or 7953? Bone, replace bridge previous site or grafted mandible maxilla
Where?
for the graft? Which one is it?
Just a socket graft. This is the one that we normally use. I think it's that one.
This one? I think it is too, the
Socket
previous
graft.
site
Yeah.
one, okay.
So the gap up here, I'm just gonna try and close with braces. We don't need to put an implant up there. It'll save you some money and it'll still be a really good solution. Okay, so I'm kind of making an executive decision on some of these things based on experience. Okay, and we'll put an implant back over here on this side. And then when we're done, we'll see kind of how these teeth have responded. You may need another implant or two on the bottom as well, but that's enough for the first phase. Once we get you stable, we get you there, then we can talk about